Siddharth, I had the strategy for our HealthMate. So what we've actually been focusing on is a B2B2C strategy. We've gone ahead and started talking to the corporate, understanding how the healthcare management has been managed at the corporate level. So while the corporate, there's a whole concept about annual health check, money gets spent, we do not realize what happens is that corporate, the money gets spent at an annual level, annual health checkup happens, and those records never talk to each other. So when it comes to corporate trying to understand what is the reading from there, that's very difficult. What we've done is we've created a whole ecosystem here where the health is not an ad hoc process anymore. It's a completely systematic ecosystem where it is looked at from a 360-degree angle in a very holistic fashion. So it does definitely start off with annual health check, where that becomes my center point in terms of data collection. The data which is used from there is then used to design the various wellness and other engagement related programs. So just to ensure that instead of having a push strategy, it becomes into a pull strategy. And the money which is being spent leads to a complete inclusive arrangement with the employees. That's how we kind of go about it. Yeah. When you look into it, we are looking at in terms of sectors. This is definitely part of the sunrise industry. Health and education are the two things which are going to shape the world. We want to look at and starting off with the health part. Yeah. So we started off the platform on the B2C side, right? At the end of the day, if you see to it, a typical user manages the health for his or her family. If you look into it, the thing which we're talking about is a 3P model. So there is a provider, which is your hospital, diagnostic lab, etc. Then there is patient, and then there's a payer. So this payer today is an individual. This payer could also be a corporate, right? The reason why we went ahead and looked at the corporate was that look into the corporate space. So I as an employee, if I get introduced to a service through my organization, the belief in that product is much stronger. Because the whole idea is that, okay, my company would have done a certain amount of vetting before introducing this product for us. And that product, if it has a certain amount of quality, then for me to start using for my own self, for my own family members, becomes a very natural process. And hence we are looking at this B2B2C model. Also, in terms of the reach, like, if you would like to talk from a single window, you'll talk to a larger audience. Trying to do a B2C approach will take a far more longer period. But if you look at a B2B strategy, the reach for us becomes much more speedy. We're looking at closing to about 12 million transactions in this current fiscal, growing at 20% month on month. When it comes to healthcare services, the execution market is India. As far as the analytics is concerned, that's also being being used in the US market as well. By next year, we're looking at expanding to Southeast Asia. Philippines is the identified market where we plan to get into by mid of next year.